All right, so we are going to start. We are broadcasting right now in YouTube. Hello, everyone, and thank you for joining this webinar that the Standing Committee on Public Health brings to you. My name is Kelvin Gutierrez Herrera, and I'm the National Officer on Public Health in OMEF Mexico. And I'm here with Jesus Castañeda, who is my General Assistant. Today, we will learn more about communicable diseases and One Health approach. And this specific topic remains as a global public health threat. That is the main reason why we wanted to have this webinar. So we, as a medical and health sciences students, will train ourselves in order to create strategies to tackle these issues. So that being said, it's an honor for me to introduce you to our very special guest. His name is Ahmed Magdi. He is the program coordinator of Communicable Diseases of the International Federation of Medical Students Associations, and he will be presenting today's webinar. Ahmed, thank you for taking the time to share a little bit of your knowledge and experience regarding this topic. So the floor is all yours.
Hi everyone. Thank you so much, Kelvin. I hope you are hearing me well. As Kelvin said, my name is Ahmed Magdi. I am I think the program coordinator for Communicable Diseases. I'm a sixth year medical student and I come from Egypt. So right now it's 11 p.m. In my local time. But the online format is giving me this great opportunity to be here with you, and I'm really excited and happy to be with you. And I would really love to get to know you better. So in today's webinar, I'm gonna speak briefly about communicable diseases and One Health approach. What is the meaning of communicable diseases? Examples, how can communicable disease spread? And the burden of communicable diseases worldwide. Also gonna hear from you about the situation of communicable disease in Mexico. If any one of you would like to share with us. After that, we are gonna give a brief introduction about One Health approach. What does it mean? What does it entail? And some examples of diseases that require One Health approach to tackle. And we will have a case study so that we can implement and think together and see how the world tackled one case study of One Health and what is the current requirements of the world. What do we need to do in order to tackle the upcoming One Health issues and the current most important One Health issue, which is of course COVID-19 pandemic. So yeah, I really hope this will be informative and fun to you. In case you have any questions at any time, you can just unmute yourself. If you'd like to open your camera, please feel free to do so. Also, we will have some questions at the end. It's like if you will have some time for questions at the end. So if you have any questions, you can ask directly during the session or at the end of the session. So it's all up to you. And if everyone is ready, we can start right now. So let's start by sharing my screen with you. Yes, so also due to time limitation, like I really would like to know you all. So if you are going to speak or ask anything, please start off by introducing yourself, like your name and your studying on and so forth. So yeah. Um, it's loading now. can someone confirm when you see the first slide?
Is it still loading? Oh, I can see it now.
Okay, perfect. Okay, so let's start off by hearing some thoughts. You can unmute yourself. What do you think? What is communicable diseases? You can also type in the chat. How can we define a communicable disease?
Are kind of like the diseases that can be transmitted from one person to another, and
Yes.
there aren't like the non-communicable diseases that really they are just acquired because of the habits and lifestyles, but these are specifically transmitted from person to person because of pathogens.
Okay, great. What's your name again?
Grisel.
Hey, Grisel. Thank you so much. Any more thoughts? Anyone else would like to add something?
Probably that they can also be transmitted through animals.
Yes. Perfect. Thank you, Laura. Okay, so by definition, a communicable disease is one that spread from one person to another through a variety of ways that include contact with blood and bodily fluids, breathing, or also breathing in an airborne virus or being bitten by an insect. So as you can see, there are many ways to be infected with a communicable disease. So for the method of spread of the communicable diseases, first thing, it could be a physical contact. For example, if a person is infected, you can be infected through touch. For example, in the Staphylococcus microorganism, it could be also sexual contact as gonorrhea and HIV. It could be fecal or oral transmission as for hepatitis A, or it could be droplet as influenza. It could be contact with a contaminated surface or object as norovirus, and organisms that could be transmitted through food as Salmonella and E. coli. And also HIV could be, and hepatitis are transmitted by blood. And it could be transmitted through water as botulism and the toxins of the botulism toxins. It could be also transmitted through insects or animal bites, just as you said. So, for example, some mosquitoes can transmit malaria or other diseases as Lyme disease, which is transmitted by tick bites. So as you can see, there are many ways to transmit communicable diseases, and that's why till now there are many countries in the world that still have problems with communicable disease. Like mostly low and middle income countries are still suffering from communicable disease as the most common causes for mortality and morbidity. But for the high income countries, it's mostly non-communicable disease. However, there's also a considerable percentage of diseases and disease burden that's caused by communicable diseases. So yeah, that's for basically for the communicable diseases. And the second definition that we have is for zoonosis. So who would like to tell me a little bit about zoonosis? What do you know about zoonosis?
It's a disease that is transmitted from animal to human. And
Okay.
an example might be like the coronavirus right now. Like it was first from the pangolin, I think, and it spread to humans.
Okay, thank you so much, Reza. Any more thoughts? Okay. If none,
Sorry.
yes. Yeah, go.
It can be transmitted if you eat the animal, if the animal bites you, if you live with the animal. It can be in different ways. It can be transmitted.
Yes, exactly. So normally humans coexist in a complex, interdependent relationships with animals, like in terms of companion, production, and just wild animals in the environment. We depend on animals for our food, for our livelihoods and well-being, as well as with the environments and live and work places. So as you can see, this normal picture of a young child, and she's coexisting with this goat. She's like it's probably of her family. So animals are surrounding us the whole time, and the interface between humans and animals and the environments that we share can also be a source of diseases, which is the zoonotic diseases. So a zoonosis is any disease or infection that is naturally transmissible from a vertebrate animal to humans. Okay, so animals play an essential role in maintaining zoonotic infections in nature. So as long as we have animals in the nature, we will have zoonotic diseases. So it's an inevitable thing to have. So we need to combat this um, in a way. So zoonosis may be bacterial, viral, or parasitic, or may involve some other agents like prions and agents like this. Many of the major zoonotic diseases prevent the efficient production of food of animal origin and create obstacles to international trade in animal products. Like, for example, this is one of the most significant things that affect the food systems, because we depend on the food production and the meat production, mainly from animals and like any kind of animals, either beef or pork or stuff like this. So if we have many zoonotic diseases, this will naturally affect the production of food from animal sources, and this will affect the economy and all aspects of our lives. So as you can see here, zoonotic diseases spread between animals and human beings. So why zoonosis is a very serious problem for us? Because right now, 6 of every 10 non-infectious diseases in people can be spread from animals, and 3 out of every 4 new or emerging infectious diseases in people come from animals. So around like 75% of all the new or emerging diseases are actually from animal nature, which is a really, really dangerous thing. And 1 billion cases of illness and millions of deaths occur every year from zoonosis. So as you can see here, human, livestock, and wildlife, and like we are all living in this world, we constantly interact with each other. So it's really, really, really normal to infect each other with zoonotic diseases. So as you can see here, there are specific diseases that could be transmitted between human and livestock, and between livestock and wildlife, and between wildlife and human, and between livestock and there's some diseases that can be spread between all these species. So these interactions in the environment that cause emerging of new diseases, because as in COVID-19, it's a new disease. We haven't heard about it before, and it's caused by some sort of interaction between the components of our system, like of our living systems. So yeah, that's usually what happens. It happens like some sort of connection between the environment and the animals that are living in the environment and the human, and there is a new disease happens. So it's a quite frequent thing, and it's not like it's inevitable. So we just need to anticipate it and tackle it effectively before it turns to be a pandemic, or before it causes outbreaks or epidemics, or something like this. So before we start talking about the epidemiological triad, do we perhaps have any questions about the previous part? Okay, if none, yes, do we have questions?
What was the question again?
Yeah, I was asking if you have any question before we start the next part.
Oh, no, it's all right.
Okay, perfect. Also, if you need to ask about anything, you can also say your question at the end. Okay, so for the epidemiological triad, it simply represents the interrelationship between agent or a pathogen and the environment and the host. Okay, so and as you can see here in the middle, this is the disease, and here we can find the interventions that we can do in order to break this triad. So simply, if you need to stop a pandemic, if you need to stop an epidemic, if you need to stop an outbreak, you need to break down this triad, understand it, and tackle each part of it. So, for example, for the agent, we have some characteristics that shapes the powerful and determines the violence of this agent, or the virulence of this agent. So, for example, the toxicity of the agent or the pathogen, its virulence, its infectivity, susceptibility to antibiotics, ability to survive outside body. So, for example, if we have the problem of an antibiotic-resistant infection, so you know that it's going to be a hard problem or a difficult problem, because this bacteria is not susceptible to any popular antibiotics or any cheap antibiotics. So you know that you will have to use some last resort antibiotics, some antibiotics that might have many dangerous side effects in the patients. So you know that it's going to be a hard or a difficult situation. Also, for the COVID-19, we know that its infectivity is really high. So we know that it's really likely to spread quickly among the population. So we know that it's going to be a hard situation for us. So, for example, also for some parasites, they have different virulence factors and different toxins that they caused inside the body. So we need to understand and study these agents and their characteristics very well, so that we can either have some ways or interventions to either eradicate these pathogens or genetically modify these pathogens in order to effectively tackle their spread. Okay. So when we go to the second pillar of the triad, which is the environment, we have some characteristics as the climate, physical structure, population density, and social structure. So, for example, we have certain diseases and certain parasitic infections that only happen in the tropical areas. For example, malaria or Zika virus. It requires some sort of suitable environment in order for these agents to spread among the population. So any change to the climate of any country, it might cause infection of new pathogens that are never that are usually not found in these areas. For example, early in this year, I think late in 2019, there were reported cases in France of Zika virus, and it was a really new situation because usually you cannot find an infection of Zika virus that is not that, and the patient was not traveling from the outside. None of his relatives was traveling from the outside, but the mosquito and the virus was it was present in France. So it was merely because of the climate change. And there are many cases like this when we see diseases that normally cannot be seen in certain areas because of the nature of the climate, and we can currently see them. So this is a really important issue that we face right now. Also, so in order to break the chain here, we can do some interventions in terms of housing quality, sanitation, water, and preventive services. So, for example, if the environment is crowded in some area, this means that this area is more likely to have more infectious diseases. So what you can do about this is to facilitate distancing, facilitate lowering the number of population in this certain area. So, for example, also in COVID-19, what governments are doing now is they are making sure that schools and universities and public places are not crowded. There is 1 meter space or 2 meter space between people, so that the environment, so that we stop this factor, which is the environment. So that the number of COVID-19 cases drop significantly, because as you know, COVID-19 has certain ways for transmission. So in order for you to stop the transmission, you need to facilitate having spaces for for social distancing. So yeah, this is just an example for the importance of environment in this triad. Also for the host, you can see what the host is the human being or the animal, or like the subject that is being infected. So once there are some characteristics that are very important when it comes to the host, which is the age, prior exposure, susceptibility, co-infection, immune response. Like for example, if we have someone who is infected with immunosuppressing disease, it's really dangerous for him to be infected with another disease. So, for example, one of the most high-risk population for COVID-19 are the people who are old age, who are susceptible people because they are immunocompromised, people who are having chronic diseases. So these are characteristics that that's related to the host that are very important in the epidemiological triad. So the interactions between all these factors represent the severity of the disease, the impact of the disease on the humans, the impact of the disease on the disease burden in a certain country or globally. And there are these are the specific interventions that can be done. And there are some interventions that can be done here also. Like, for example, for the environment and the agent, we can remove breeding grounds and improve sanitation. Like, for example, for the malaria in tropical areas, there is an important step in infection prevention is that they should remove all the water from the streets and the places that are good for breeding the mosquitoes. And also, as you can see here, for the environment and the host, you can educate the host or educate the people, change activity patterns, quarantine, for example, in the COVID-19 pandemic. And also here for the agent and the host, you can protect the host from the agent, educate the host about the agent, and alter the exposure patterns of the host to the agent. So yeah, also for this epidemiological triad, it could actually inspire you as scope heroes to do projects in your country, or on your local community. So, for example, if you are suffering from certain communicable disease in your community, you can identify these factors of the disease and identify your local situation, what is the problem, what could be done, and so on and so forth. And you can choose either to educate the population, you can do something about the agent, you can do something about the environment. Like there are countless options here. Like it's only according to your resources and your capacity to choose the right intervention to decrease the burden of the infection. Okay, so I hope this triad is clear. I know it's a bit complicated. It could be a bit complicated, but if you have any questions about this triad now, please let me know.
For example, chronic disease is only the affection for the host, or with the host and the environment, it's the problem that has the chronic disease.
Sorry, can you repeat again? And
yes, with the chronic disease like diabetes, the host it is the principal problem that causes the disease, or it's with the host and the environment. I don't know if I think.
Oh yeah. Okay. You know. So. Okay.
Like, we know that a chronic disease, it's not like a with the age, like a virus or what another agent. It's only with the environment or the host. Or the chronic disease, it's just for the host, or it combined with the host and the environment.
Okay, so I think I got your question. So, for example, if you have a disease like malaria, okay, so so we have the agent. Okay, so we will have actually let's have this example. So, for example, we have the brucellosis. The causative organism is the Brucellus abortus or canis, or like we have 4 different types of brucellosis according to where you are staying. We have the reservoirs, cattle, dogs, sheep, goats, pigs, and other species. We have some portal of exit, for example, infected birthing tissues and fluids, for example, placenta, aborted fetus, fetal fluids, vaginal discharges. The bacteria can also found in milk, blood, urine, and semen of infected animals. And we have this mode of transmission. For example, ingestion, direct contact through breaks in the skin, and airborne infection. Laboratories and abattoirs, especially for the veterinarians, primarily affecting consumers of raw milk, people who consume raw milk, and derivatives, its derivatives, or like the derivatives of the raw milk, farmers, butchers, veterinarians, and laboratory personnel. And we have this portal of entry: mouth, conjunctiva, respiratory tract, and skin. And we have the susceptibility. So why am I giving this example? Because as you can see here, we have the agent. Okay, so we have different characteristics of the agent. So the brucella is susceptible to some antibiotics. So we know that we have some antibiotics to tackle the problem. However, the brucellosis is the bacteria is somehow toxic, and it's somehow powerful in virulence, and it's infective as well. Um, we also study about its ability to survive outside the body. Okay, and for the environment, we know that what causes the brucellosis is that either the situation or the conditions in the farms or in the places that in the places that we slaughter the animals um, are not um, are not good enough. For example, the most susceptible population of the brucellosis are the veterinarians and butchers, because they deal a lot with cattle in laboratories and abattoirs. So this is the environment. The environment is a huge risk for infection of brucellosis. So for the host itself, we have some characteristics. So we know that the risk factor of being a veterinarian is high to be infected with this disease. So what do we need to do here in the epidemiological triad is that we connect all these factors, connect all these characteristics, and decide on what is the best way to tackle this disease. So, for example, for the veterinarians, they need to have proper personal protective equipment when they are dealing with infected cattle. Okay, for consuming the raw milk, you need to boil it well. You need to cook the meat well. You need to cook the derivatives well, and so on and so forth. You need to, as a health system, you need to provide proper antibiotics to treat the brucellosis. So this is like identifying how to go about solving the problem of the brucellosis. Okay, does this make sense for you?
Yeah, okay, thank you.
Okay. Do we perhaps have any questions?
No, everything's okay.
Okay. And also, just a quick note. There's a difference between communicable disease and the non-communicable diseases. So this epidemiological triad is only for communicable diseases, which are the diseases that could be could be transmitted from a person to another or from animal to person. Okay. So let's talk a little bit about the chain of transmission. So we have the infectious agents, which is usually bacteria, fungi, parasites, or prion, and they are the microorganisms that are capable of causing diseases or illnesses. And we have the reservoir. The reservoir is the place in which infectious agents live, grow, and reproduce. For example, the reservoirs could be people, it could be water, it could be food, it could be some sort of snails, animals, anything like that. Portal of exit, it's the way in which infectious agents leave the reservoir. It could be blood, it could be secretions, it could be excretions, it could be skin, as say brucellosis example. For the mode of transmission, it could be physical contact, it could be droplet, it could be airborne, and they are the ways in which the infectious agent is spread from reservoir to the susceptible host. And as for the portals of entry, they are the ways in which the infectious agent enters the susceptible host. So, for example, the mucous membrane respiratory system, digestive system, and broken skin. And for the susceptible hosts, we have some characteristics as immune deficiency, diabetes, or chronic disease in general, burn, surgery, age, and they are important because each individual could be susceptible to certain diseases, and other diseases it could be immune from these diseases, or not immune, but let's say difficult to be infected or not likely to be infected with these diseases. So why the chain of infection is really important, because for every communicable disease, we identify these all factors, and we, in order to stop the disease from transmission, you will have to break this chain. Okay, so let's have a small exercise. Okay, let's have the COVID-19 as an example for the chain of transmission. So who could tell me what is the infectious agent?
The SARS-CoV-2. SARS-CoV-2.
Yes, the SARS-CoV-2. Great. So it is a virus. Okay. So what is the reservoir?
People.
Yes, people. Thank you. Portals exit.
Secretion.
Sorry, I didn't hear. There were many people speaking at the same time.
I think it can be through the mouth or through the nose or just droplets.
Okay.
Sorry, I have a question here.
Yes.
What's the difference between secretions and excretions?
Okay. Secretion is like it's like the sweat. It's like the tears and like this. Excretion is like the urine and feces.
Okay, thank you.
Okay. So yeah. So the portal exit, I couldn't hear. Can you please repeat? Yes. Airways such as mouth and nose. Okay, perfect. Thank you. So mode of transmission. Who can tell me?
Droplets.
Droplets. Okay, thank you. And also, there is some theory that there is some sort of airborne infection for COVID-19, but in some conditions, like for example, in hospitals and places that involves procedures that aerosol generating, for example, in ICUs and places like this when there is severe interaction with the COVID-19 patients. But normally it's droplet infection, but in certain places, doctors and healthcare workers should take the precautions of airborne infections. Okay, so what is the portal of entry?
Airway.
Airway.
Membrane.
And mucous membrane, yes? Perfect. So susceptible host, what makes the people susceptible for COVID-19? Who is the most susceptible population for COVID-19?
The age.
Age. In old age or? Yes, old age.
Those who suffer from chronic diseases such as like diabetes and hypertension.
Yes, perfect. Immune deficient people and people with chronic disease.
a mask?
So people who do not wear a mask, it's about the mode of transmission, not about the susceptibility. Like, for example, the susceptibility is something about your body. Okay, so yeah, you get me now. Thank you. Okay, so we had this example of brucellosis. We had the causative organism, reservoir, port of exit, mode of transmission, port of entry, susceptibility. So if you need to solve the problem of brucellosis in certain population, we need to break this chain. So for example, if we make sure that the reservoirs do not get infected with brucellosis, then because the organism won't have any place to reproduce, then we will not have any place, like any infections with brucellosis. If the veterinarians and the butchers use proper equipment when they are dealing with the cattle, then they will not be infected, and so on and so forth. So as in COVID-19, we try to break that chain by wearing masks, keeping social distancing, and so on and so forth, until we have the opportunity to develop a vaccine and eliminate the causative organism itself, so that we will not be, or like we won't have to go through the whole process of eliminating the chain of infection. So yeah, let's proceed if we do not have any questions. So yeah, for the next part is the One Health approach. So yeah, let's start. Can someone define One Health approach for me, please? What are your thoughts about One Health approach? It involves the treatment. Can you elaborate more, please?
Like, how is it the best way to prevent from spreading a disease or something like that?
Yes, perfect. Thank you. Any more thoughts?
Can you hear me?
Yes.
Okay, yeah. So it's kind of like a collaborative effort that are put together from different disciplines throughout the world, like globally, to make to attain optimal health for people, animals, and then our environment, basically.
Yes, perfect. Thank you so much. Do we have any more thoughts? So Samantha says that it's an approach in which many sectors come together to achieve a better health. Yes. So yeah, let's have the definition. So basically, One Health is defined as a collaborative, multi-sectorial, and transdisciplinary approach, working at the local, regional, national, and the global levels, which are all the levels, with the goal of achieving optimal health outcomes, recognizing the interconnection between people, animals, plants, and their shared environment. So yeah, as Grazel said, the ultimate goal is to have treatment, or to solve the infectious disease issues. And as Samantha and Akarius said, it involves many sectors globally and in all levels. So let's have some figures to understand this better. So as you can see here, there's interconnection between human, animal, and the environment, and this this is where we find the One Health approach. So One Health approach is not a discipline itself. No, like you cannot enroll in a bachelor degree for One Health. There's nothing like this, but it's a very valid thought if you have thought about this before, because it was like a big argument in the scientific community that it's took many years to be settled, but now it's recognized as an approach, which is a collaboration between different disciplines. For example, between a different discipline of the human medicine, veterinary medicine, pharmaceuticals, dentists, engineers, media, and all the sectors that are interested in human health. So basically everyone, but mainly the sectors that are interested in human, environment, and animal health. So let's have also this, as you can see here, this umbrella. So now there are some of the more traditional biomedical sciences that fit under One Health, and also other stuff that are not traditional in our thoughts. Like, for example, as you can see here, you can find environmental health, ecology, veterinary medicine, public health, human medicine, molecular and microbiology, health economics. You can find here the genetic infections. You can find in the comparative medicine and translational medicine that study the metabolic disorders in humans and animals, joint and skeletal diseases in humans and animals, human-animals bond, environmental hazards, exposure to humans and animals, and so on and so forth. So it has a very wide spectrum of disciplines that could all serve the One Health. Like, for example, if you are following up the COVID-19 situation really closely on a global health level, there are many health and data scientists that are working to make models for the disease. It has nothing to do with medicine and pharmaceuticals per se, but it has a certain connection with data science and analysis and the statistical analysis, and engineering and software development and like application development, so that they make a model to predict the transmission of the COVID-19 disease, and because like because they also want to anticipate what is the next pandemic will look like. How could we prevent the next pandemic from happening, and what are the animals that are most likely to cause to produce the next causative organism that could be the cause of the next pandemic. So it's a really big field of work, and it has so many disciplines working under this umbrella. So as you can see here, also this connection between the three fields. It has so many fields here, even atmospheric sciences, climate science, earth science, botany, oceans, agriculture science, and like it's an endless spectrum of sciences that work together to have a common goal. So is the definition of One Health approach clear, and the spectrum of the work clear for everyone now? Or do we have any questions?
Yes, it's very clear.
It's okay.
Perfect. Okay, so can you perhaps tell me some examples of diseases of One Health importance? we have said a couple of them now, but I would love to hear more.
I think
Coronavirus. Okay.
Yeah.
Yes. What else?
Dengue.
I think
Zika.
Dengue. Yes. Zika.
AIDS.
What again?
AIDS.
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 I couldn't hear you. Can you type it?
I mean, SIDA. BH. Yeah. AIDS.
Yes.
It means HIV or AIDS.
Yes. Okay.
Yeah, that's thing.
Great. What else?
malaria,
Malaria. Yes.
rabies, and
What else? Okay, so some diseases, it's of course not all the diseases, but some of them that have One Health importance, as some of you have thought, influenza and rabies and leishmaniasis. And leishmaniasis, it's one of the most damaging tropical diseases that exist. It's many people suffer from leishmaniasis till now. Zika, West Nile virus, and similar arthropod or vector virus. Someone just said dengue fever. It's also a very popular disease related to One Health. Also, we have some other diseases. You might not have think about these diseases, but if you have thought about these diseases, it's really great. But there are a few examples that need to be considered as well to keep the human healthy at the population level. For example, the guinea worm is a zoonotic parasite that necessitates people leashing dogs to prevent their exposure, and notably, in order to prevent the exposure of the dogs, we have to leash them so that we accelerate the eradication of this worm. And there are other diseases like this, like the transmissible spongiform encephalophysis, and tinea, which is a popular parasite that infects cattle, pigs, and whatever what eats these animals. So it creates a huge burden of the areas that rely on traditional livestock, and also animals and plants can also transmit non-transmissible diseases. Like, for example, there are numerous examples of toxins or ionizing radiation from nuclear disasters that can build up and be transmitted from the environment to the animals. Like, for example, it's not per se an infectious disease, but it's something that's dangerous for the environment. Like, for example, if we have dangerous materials that are stored in the earth, and plants use these materials to grow, and you eat plants, which is a part of the environment, you get diseases, not necessarily communicable, but it's also dangerous for health. So One Health, like diseases that are related to One Health, are not strictly related to communicable diseases, but it's anything that have anything to do with the environment and the human and animals. Okay. So even for obesity, it's not transmissible. It's not a communicable disease. It is a non-communicable disease. However, for example, if you have a dog, then you are likely to be you are likely to adopt a healthy and active lifestyle, and this will actually decrease the obesity. I know this is really not expected here, but this is what the people or what the world needs to think about, how the relationship between animals and the human can serve the human health in a better way. So, for example, as we say in obesity bit, that pet ownership is a major protective factor against this disease, because you do not have to adopt you cannot adopt a sedentary lifestyle if you have to walk your dog every day and so on and so forth. It's also protective factor against cardiovascular disease and so on and so forth. So yeah, even though it's not a communicable disease, it's also important because your animal helps you with this. So I'm saying this because just because I want to show you how comprehensive and holistic the One Health approach is. It really involves everything in our lives. So yeah, let's have this case study, and it will be the last thing in our session. So the SARS outbreak, 2002, 2004. So just quick question: how old were you in 2004? I was 8 years old, I think. Yeah, I was 8 years old. 9. Okay. 4, 7, 3, 5. 1 year. Okay, you're really young. Okay, we have old and young scoffers here, which is great. Okay, thank you everyone. So even though it was really, it's a really an old case study, but it was really important milestone in the history of One Health, and we're still learning a lot from this case study. So in November 2002, an outbreak of mystery pneumonia in this animal happened in China. So it was some sort of coronaviruses. It's not the current coronavirus. It was another sort of coronavirus, and we knew that it transmits from humans, from these animals. I think it's called civet, and possibly reservoired in bats. It's a spread caused 8,000 cases in 37 countries, and resulting in more than 700 deaths. So even though it was not it was more than the current COVID-19 virus in terms of its fatality rate, because it has higher fatality rate. However, it was not as transmissible as the current COVID-19, but it was one of the real drivers for a paradigm shift in how we think about global and public health. So many stakeholders and many contributions happened to stop this pandemic. So we had groups involved in response extended vertically and horizontally across society and across countries. We had community to global actions in molecular biology, communications, experts on different animal species, and human as well. As you can see here, you can see all the sectors were involved: communities, practitioners, disciplines like biology, ecology, economics, epidemiology, ethics, geography, microbiology, political sciences, sociology, public health, human ecology, development studies, and many disciplines. Also many sectors like health, environment, development, agriculture, transport, planning, many units of the governments, and it was a really huge collaboration and contribution in order to stop this pandemic. So for the SARS outcomes in terms of the One Health benefits. We have been trying to focus on how to predict and prevent disease outbreak before the even start, and this there is actually so much fun happening right now in this in this particular area, and so many researches on how to predict the future pandemic, how to predict the future outbreak, which animal could possibly produce the next pandemic, and so on and so forth. And also how can we improve our speed to react in another outbreak, because as you can see, so far the WHO has declared COVID-19 as a pandemic in March 2020, and now we are in September 2020, and we have many vaccines in development phase. Many vaccines are actually are going to be approved soon if they fulfill all the requirements. So this is a huge improvement. We could have not done this without learning so much from the SARS-CoV from the SARS experience, and we are still learning a lot from the COVID-19 pandemic, and we will continue to learn about the COVID and other One Health issues in order to anticipate the next pandemic. So also one of the outcomes was that how can we further integrate our public health infrastructure across international borders? How can we change how we interact with our lifestyle? How do we own? How do we eat? How do we interact with our pets that live with us in our homes? How do we interact with the cattle? How do we interact with the wildlife? How can we make interaction with animals more safe? Like, for example, there was a huge issue about the wildlife animals market in some countries. So, and the biohazards that are related to these markets, and whether they are safe for human population or not. And so many regulations and laws have been made just to tackle this issue. Also, unfortunately, some of these questions we are still facing right now in COVID-19 because of many reasons. Maybe lack of proper funding, maybe lack of research, maybe because we were not anticipating the pandemic could be this this difficult, could be this hard to tackle and hard to face, and really it was really fast in its spread. It almost affected the whole world in a couple of months. So yeah, it was really hard for the people to anticipate this. So yeah, these were the lessons learned from the COVID-19 from the SARS outbreak back in 2004, and we are still asking some of these questions right now, even though we have learned a lot during the past few years. So yeah, to wrap up, we have identified some communicable diseases. We have defined communicable diseases. We have talked about the epidemiological triad, how to stop the pandemic through stopping the transmission circle, and how to possibly stop any infectious disease. What kind of intervention can we do in our local communities? So for example, if you are suffering from a certain communicable disease in your community, you just need to identify some things, develop your activity according to this, and if you have like according to your resources, your manpower, your collaborations, you can choose which way is better to tackle this problem in your community. And then we have discussed One Health approach. What does it mean? Who is involved? What are the three domains of the One Health approach, which are human, animal, and environment? And finally, we have discussed the SARS case study of 2004. And yes, that's it. This is the time for question. Do we have any question?
I have one question. Thanks for the webinar. It was very interesting, very good. I have a question on this. There's any way we as LPOs can implement some One Health strategies onto our work in our cities or our schools?
Yes, thank you so much, Eric, for this interesting question. So myself, I was an LPO last year in my local committee, and also I was a national coordinator for antimicrobial resistance national project. So I've met this interesting alliance in my university and in my NMO, which was an alliance of One Health. We have collaborated with students from veterinary association. Like there's an association, it's called the IVSA, International Veterinary Students Association. And there's another federation is called IPSF, International Pharmaceutical Students Association. And there's also a federation for dentistry students. We have collaborated with each other on the AMR project. And we have done an activity in our university that involved all of our disciplines. You can also expand this by collaborating with data science students, with environment students, if you have any in your university. Also with engineering students, you can do hackathons and stuff like that. So yeah, it's possible. You just need to start off by introducing them to the One Health approach, because when I was starting, I had these difficulties in approaching them, because their structure in this federation is a bit different from our structure. So you need to understand their processes and make them improve their awareness about the One Health approach at the beginning, and why is it important for them and for us to work with each other. Like on a global level, on an international level, we work with IBSA and IPSF. So it's gonna be very, very helpful if you refer them to the international campaigns, because there's something called World Health Students Alliance. It's formed from IFMSA, IPSF, IBSA, and IADS, which is the International Students, and I think other student organization as well. So if you can introduce them to our activities, they can get really, really interested in this work, and this will happen. Like, I swear, like magic will happen when you start this alliance, and it's gonna be very, very, very impactful. And yes, good luck.
Thanks.
Do we perhaps have any more questions? Feel free to ask anything. If you have any ideas that you need to implement in your local community, if you need any guidance in activity management or any stuff like that, please feel free to approach me. I'm kind of finishing my term as a program coordinator, but I'm always here to help if you need any help. Thank you.
Okay, so I think we don't have more questions.
Okay, so I have one last thing to say. So just so that you guys become more aware about the international effort of IFMSA regarding the One Health approach. So this year we had this initiative with the IVSA, which is the International Veterinary Science Association. We had formed a One Health working group. This working group aimed to create a workshop on One Health, a One Health approach, and this workshop was already was finished, and it was proposed for the amendments to the scope regulations during the online GA in August meeting, and it was successfully adopted. So we now have a new workshop about One Health that you can do in your NMO. You can propose it for an SRT or regional meeting or in IFMC pre-GA. So yeah, we have done this. Also, we have collaborated with them to community in IVSA. It's called IVSA Konya. It's a city in Turkey, but it was postponed due to the COVID-19. It was supposed to be in April, I think, but it was postponed to November. I'm not sure yet if it's still going to be happen in November, but if it's going to be happen, we will share it on scope groups. So maybe you can attend something like this as well. And yes, just keep updated to the and subscribe to the SCOF channels so that you can get any updates relevant to One Health. That's it.
Thanks a lot, Ahmed. So I think we reached to the final and the end of this webinar. Thanks a lot to everyone who joined us, everyone who was here in the Zoom meeting, and everyone who was watching from the YouTube broadcast. Thanks a lot again, Ahmed, for your time. And this was really, really nice. I think we learned a lot. So if we have any more questions, so all the LPOs who are here, feel free to ask me, and then I can reach Ahmed and ask him directly. So I think this is the end. If we have more questions, you can leave it here. And if we don't have more, so we can freely go. Thanks a lot.
Thank you very much.
Yeah, thank you so much, everyone. I really enjoyed. So I'm gonna wait a bit if you have any questions to receive.